Being a part of the Bronx News Initiatives has really helped us to network with our other community partners, with CBOs, with the hospitals, with other health centers, so that we're all working towards the same goals. We help each other in linking patients to care and doing outreach, really in trying to engage the public and increase awareness so that by the year 2011, every resident in the Bronx will know their status.
In 2007, the Highbridge Morrisania area had 104 cases per 100,000 people in the community. Here we serve a large portion of that community. We are interested in getting all the patients who come through our doors tested. When a patient comes to be seen at the facility, the patient is asked the question by the patient care associate, do you know your HIV status? And do you want to get tested? It is a mandatory field in the electronic medical record, so all patients will be asked this question. If the patient is hesitant, the provider will further ask the question.
Have you ever known your HIV status?
No, I don't.
We understand how important the doctor-patient relationship is, and we understand that the patient may feel more confident having this question asked by the provider. If the patient is interested in getting HIV tested, we send the patient to see the counselor. The earlier you know your status, if you're HIV positive, then the likelihood is that you can lead a perfectly normal life with treatment. We are currently testing about 1,000 patients a month.
Morris Heights has been providing primary care services to this community for over 28 years and was one of the pioneers in providing HIV primary care services and in HIV testing. The college-age students do not typically see themselves as at risk. They don't see themselves at the face of HIV. They feel they're invincible.
It's the only age group, 13 to 19 and 20 to 24, in which HIV rates have continued to rise while they've stayed the same or gone down in other age groups. Particularly young men who have sex with men, young men of color, Black or Hispanic, which is what this borough is all about, are the most vulnerable.
And so we decided that, if the young people do not come to the clinic just for care, only when they come to do a routine physical, why don't we go to them?
We have rates in this community, 12, 18%. That's as high in countries of Africa, where HIV is recognized as a national emergency.
We have a school-based health program where we actually have on-site school clinics in middle schools, and recently we just acquired 2 new high schools. And we collaborated with that department to do testing in the schools.
It's very important to reach them, test them, and engage them in care. Number 1, to prevent them from dying from the disease. Number 2, to give them the tools to diminish the risk of transmitting the disease.
We've partnered with 2 colleges, Lehman and Monroe. We go and test there on a weekly basis. We also test at Bronx Community College. HIV testing is now no longer perceived as just for people who are perceived at high risk, because we test everybody, all the students. There's no profiling, no targeting. And we've taken this also to the community. We test in the parks, we test at barbershops, we test on the street corners, especially in the evenings between 6 and 10, and on Saturday mornings.
Community Healthcare Network started offering HIV testing for the last 20 years to women who were pregnant. At the time, it was to believe that only gay males were being exposed to HIV.
The Bronx Health Center offers comprehensive medical care to our community, and we have a vast number of HIV services.
Everyone in the staff, from the social worker, the nurse, the health educator, the HIV counselor, And in many instances, the center directors will be trained on how to offer the counseling.
We seek community-based organizations that would allow us to go in there and do HIV counseling and testing, such as this salon where we are today.
This event is the best venue for us to go out into the community, bring the HIV message in the context of health as a whole. HIV is part of the routine care.
One of the most important things that we look for when developing a relationship with a local business or community-based organization is that they have a private place where we can do the test.
Esto es el consentimiento. The clients who came over here was happy at that moment when they got a chance to be tested for HIV here at the salon while they were doing the hair.
Due to the work of the community and this program, we have around 5 women who are pregnant, who are HIV positive, and receiving care at the Bronx Health Center. And this is very important because in the past year, out of the 5 that we have, none of them have a positive child.
They're getting 2 services. They get the hair be done plus the HIV test.
Community partners are the ones who's going to keep the health of the community.